Our students live in an age of social media where they're surrounded by images of beautiful people with beautiful bodies, and it can be a lot for anyone, but especially our students, not to compare and contrast. Body dysmorphic disorder, or BDD, or body dysmorphia, is a mental health condition where people spend a lot of time worrying about flaws in their appearance. There are things like they think they're too fat, their nose is the wrong size, their hair doesn't look right, and these usually are things that most other people don't even notice or so minor. People of all ages can have BDD, but it's most common for our teenagers and young adults, but it also affects both men and women. So here's some signs to notice when you have a student who has BDD. Number one, they focus on their looks to an extreme. They have such a hard time, they may ask people over and over, do you see this pimple? Did you notice it? Or they'll say, is my hair look okay? And they'll go over and over and ask about it. And they also may go to extreme measures and even look into getting plastic surgery. Number two, they feel upset about their appearance. This makes them feel anxious, worried, stressed out, and they're worrying about their looks all the time. And even sometimes they can get angry and be irritable to you. Number three, they check or fix this body part often. Students who have body dysmorphic disorder will need to check their appearance over and over. They may go to a mirror and keep looking and looking, or they may be the kid that brushes their hair constantly and constantly. On the opposite side, number four is they try not to be seen. They may be the kids who stay home and miss out on things. They may be the friends that cancel on you all the time. They also may be the ones that use makeup, hats, or maybe the ones who wear the hoodies all the time and have it around them, or they totally avoid looking at mirrors. And number five, they have a false idea about their looks. They're constantly looking at those flaws and they're focusing on them so hard that they don't notice the other things, or they exaggerate them so much that it even gets worse in their minds. So what can we do and say for our students that have body dysmorphic disorder? Number one, know how to talk with your student. It would be really easy for us to say things like, oh, you look fine, or your appearance is great, but we don't want to minimize their thoughts and how they feel about them. Also, try not to answer their questions over and over again. Things you can say is, gosh, I see you're really upset about that today. Tell me about it. Or maybe you could say something like, this is your body dysmorphic talking to you, and how can we look at things differently? And sometimes our kids may not even want to talk to us. That's okay. It's okay to be a good listener. Things you can do is just give them a hug and let them know you're there. Number two, be patient. Individuals and our students who have body dysmorphic disorder, they may withdraw and not want to be with people. And that can be really frustrating as parents or as leaders because we want to be there and we want to help them. But just stay calm and be patient. It's okay to give them space, let them have some time, and they can work on their things and come to us when they need you. Number three is encourage time with family and friends. For a lot of students who have body dysmorphic disorder, they want to stay away from people. They tend to be by themselves because they're so fixating on their things. But it's important to do the small things, even if it's doing chores or just hanging out, having family dinners. Sometimes just sitting together at dinner and just talking about your day, the good things that happened, can really calm for a lot of our students. Number four is support other interests. Help our students enjoy something else. Maybe they have hobbies or sports or maybe friends, and really support those things so they can stop worrying about the body dysmorphic things. Number five, and one of the most important things, is monitor screen time. Our kids look on social media all day long. They're on TikTok, they're on anything else. And so they're looking at their flaws and what other people don't have, which are airbrushed. And so they're constantly looking for things to not feel depressed and feel anxious. And so allow them time, but also be aware of what they're looking at and remind them that these aren't always true to nature and who we are. Lastly, pray for your students. Pray for them, what they're going through. And your prayer can sound something like this. Lord, I lift up my student who struggles with BDD. And you've said it so perfectly in Psalms 139:14. They are fearfully and wonderfully made, even if they don't see that sometimes. You made them perfect in your eyes, and their imperfections are because of who they are. May you give us the ability to be calm and understanding and embrace every part of them and let them know that you are their masterpiece. Allow me to walk beside them and support them. as they're going through this. And may my words and my actions be just as you would, to encourage them and support them. And thank you for allowing them to be a part of our lives. In your name, amen.